Hello, my name is Dr. Jacqueline Limoges, and I'm the online course facilitator for Development of Self as Nurse, Ethical Ways of Knowing and Caring. This course, like other courses in your BSCN, help you to develop the knowledge, skill, and judgment required of the registered nurse. However, unlike other courses in your program, this one will likely leave you with more questions than answers. In this course, we help you to develop the knowledge, skill, and judgment to work with patients and their families during situations that are highly complex and where there are many possible courses of action, thus making it an ethical dilemma. This course also helps you to begin to understand the difference between what is good and ethical, and to recognize when a situation is an ethical dilemma versus an interpersonal conflict. When we can make this distinction, we are then able to use our knowledge and skill for resolving ethical issues. In this course, you will learn several different theories, philosophies, and models to help you work with patients and their families to resolve ethical issues. This is key learning so that you can meet the professional practice standards and also to meet the expectations that patients have of nurses with respect to dignity and worth. The readings for this week will provide further details on why nurses study ethics and how nurses use this knowledge in practice. Before we begin class number 1, I just want to mention that there is a short tutorial and orientation module that was created to help you learn to navigate online learning. Learning in the online format is quite different from face-to-face classroom, and for many of you, this might be your first online course. So before you proceed into class number 1, I'd like to strongly suggest that you have a look at that orientation module. I'd also at this time like to give mention that the online design was created in assistance with Bob Marchessault for the Center for Teaching and Learning. Also, before we get going into class number 1, I would just like to discuss with you for a moment issues of confidentiality, privacy, and how we might create a space for exploration and open dialogue. One of the key strategies that we use for learning ethics in nursing is that we use case studies and examples from our practice. It's therefore really important that we create a space where we can discuss issues that we're facing in our day-to-day life, but we do so in a way that respects patient confidentiality and the privacy and confidentiality of those with whom we work. Therefore, I would just like to mention that any postings that are made or any dialogue that happens in the course remain content that stays within the course, and that every posting be made as anonymously as possible. We can use or we can just use a standard initial, patient X, nurse X, Dr. X, and we shouldn't mention the institutions in which we work. So we'll talk a little bit more about that as we move through the course. As discussed in the online orientation module, each week begins with a set of purpose statements and objectives, the things that we're trying to accomplish during the week. In this week, class number 1, there are 6 things that we're trying to do. One of the first things is to understand how online learning is structured and specifically how this course is organized to help you learn. We're also going to be talking about how we can create an awareness and an understanding for why nurses study ethics, including what is ethics. We're going to understand why this course is relevant and important to professional practice. One of the other activities that I wanted to do this week was to examine the course content, the readings, and the assignments so that we can understand how these are used to support your learning about ethical practice. You'll see in the course syllabus that there is a weekly flow sheet, and you'll see that there are assignments that are described in detail. I'm just going to be giving an overview today, and as you work through those assignments and read them for yourselves, there'll be a discussion forum for assignment work. One of the activities that I would ask you to please do this week is to locate the Moral Preference Indicator. It's a hyperlinked document within course resources, and to print that survey and to complete it. You might not necessarily know what all of those words mean, but certainly throughout the course of our 13 weeks together, you will get to know those words quite well. We use this moral preference indicator completed in week 1 as in a form of a pretest, and then in week 13, just as we're nearing the completion of the course, I'll ask you to do it again, and it will be interesting for you to compare and contrast your preferences and how you're thinking about things differently, if you are in fact. And the last is to ask you to please join the discussion group so that we can begin to learn about each other and our expectations for this course. So all of you have been in practice settings now for 2 semesters, both for Health and Healing 2 and Health and Healing 3. And I know from being a practicum mentor that many students are already realizing that there are ethical dilemmas and ethical issues in their midst. And so we as nurses study ethics, which is a branch of philosophy, to help us discern what is good and what is right, what ought to be, and how we might be able to change situations or work with people in a different way toward an ethical practice. The study of ethics as a branch of philosophy helps us to understand how individuals and groups make choices and behave in certain situations. And when we have theories and frameworks and philosophies, these can help guide our analysis and help us explore issues in a deep and profound way to help us advance our practice. Okay, I'm just going to pause here and remind you that I've been making a few introductory comments about why nurses study ethics and how nurses use ethics in practice and what is ethics. But I would like to also mention that a big portion of online learning requires independent study and independent reading and writing. So each week there are assigned readings, and this week was no different. There were 2 articles and an introductory chapter from your textbook that you were asked to read. Those resources will provide a much deeper understanding than my small comments made here within the PowerPoint. Also, I wanted to pause here to let you know that in the discussion forum, there will be a place for you to discuss ethical issues that you have faced so far in practice. I'll just remind you once again that when you're making posts in the discussion forum, that you pay close attention to the guidelines around privacy and confidentiality, and to make sure that any post that you make about your practice is done in a way that is anonymous. So this forum will give you a chance to begin to discuss with one another about the issues that you're facing in your practice, and perhaps how you handled them, or how you wished you would have handled them. As you discuss in the forum about ethical issues that you have faced so far, you might be interested in using some of the questions listed on this page to guide your thinking and your exploration of that situation. These are common questions that nurses ask of themselves when considering the ethics in their work. Questions such as, what is ethical nursing work? What does it look like? What is good? What is harm? What is ethical? How will I know that my practice is ethical? And what are the differences between morals and ethics? As promised, this course will ask more questions than it answers. However, it is believed that questioning our values, beliefs, and views is an important part to ensuring that our thinking is deep and thorough. In healthcare today, so much is possible. For example, there is cloning, genetic screening, life support, etc. However, ethical thinking asks us to consider, does just because we can do something mean that we should? These 2 questions are central to ethical reasoning. What do they mean to you? It will be interesting for you to record your answers to these questions now in our discussion forum, and then for us to re-examine them towards the end of the course to see if our views have changed. And in fact, there is an assignment that creates a circumstance for you to be able to do this, and we'll talk about that later when we discuss the syllabus. In this slide, and in the next several slides, there are questions that I've written for you. The point of these questions is for you to hear the question, which I will read to you, and for you to answer using a Likert scale from strongly agree to strongly disagree. The goal here is for you to begin to understand that what our views are on what is good, ethical, and moral changes depending on the context. It will be interesting for you to come back to these questions toward the end of the course to see if your views have changed at all. So here, in this first question, I'm asking you, I am a good person, therefore I will do good. The unit is really busy, and finally I get my break. After my allotted 15 minutes passed, I decide to stay for another 10. Am I acting ethically? I can hear the patient's call bell, but I am trying to get my charting done so that I can go home. I let it ring for 10 minutes before answering it. Am I acting ethically? My class is writing a test before other sections. When I leave the exam hall, I text my friends with as many questions as I can remember so that they can look up the answers before their test. Am I acting ethically? I have an ethics essay from another course, and I plan to use sections of it with words changed to avoid detection by Turnitin. Am I acting ethically? I notice a nurse being short with a confused elderly patient, but say nothing. Am I acting ethically? The unit is very busy, and you forgot to give a patient his digoxin. It is now 2 hours past due. You give it to him and don't make an incident report or tell the patient it was late. Are you acting ethically? Your patient has delirium and is constantly asking for her husband, who died last year. You know it will only upset her if you tell her he has died, so you say, "He'll be in to visit later today." This calms her. Are you acting ethically? And here is the last question. Your patient has an addiction to narcotics and underwent a surgical procedure. Worried that you are feeding his addiction, you always give the lower dose in the range of narcotics. Is this ethical practice? So now that you've worked your way through some of those questions, you have that opportunity to look at how your decisions reflect your values and beliefs. And as nurses, we are nurses as both individuals and as professionals, and there's a melding of the two somewhere in the middle that is important for us to consider. And when we're working in professional practice, the expectations that the public has of us are quite different. What are the links between the personal and the professional, and how can knowledge of ethics help us to bridge these? What is the student nurse's involvement in ethical conduct and ethical decision-making? What are the frameworks that guide us as nurses and nursing students? This is what the course is all about. In this slide, I've created a small table to show you some of the Canadian Nurses Association and some of the College of Nurses of Ontario statements regarding ethical values for registered nurses. There is similarity between the CNA and the CNO, and this slide is really meant as a reminder for you to go in and read the statements about ethical practice, both from the CNA and the CNO. These are statements that guide and orient our practice, and they're also the statements for which we are measured against. They're our expectations and our professional standards. So have a read through. We will continue working with these statements throughout the course, but it's a good idea at this point to take a moment to read through. In this slide, and then in the next 5 slides, I've created a summary of one of the required readings for this course. I won't create these summaries every week because you won't need them, and in fact some of you may prefer to use your own summary even now with this first article, and by all means do so. The point of this summary is to just give a little bit of guidance of the way that you might create a summary of a required reading and the kind of information that you might choose to pull out. At the end of this summary, there are some questions that you can use to help guide your integration of this study into your practice. I'll read each slide to you. In the introduction to this course, the authors talk about how U.S. nurse educators must create learning environments focused on the socialization to the role of nurse and facilitate learners' self-reflection. They suggest that ethics education, an essential area of study, helps develop critical thinking skills, and that ethical reasoning, defined as discovering what is real, seeking truth, fostering decision-making, and ethical practice, helps nurses with moral reckoning. This is when nurses critically and emotionally reflect on motivations, choices, actions, and consequences of troubling patient care situations. To prepare us to understand the study and to help the researchers prepare themselves to conduct the study, they conducted a literature review. And in the literature review section of this article, they describe various studies that looked at clinical experiences of students, identifying that real world of nursing challenged students' ideals and that incidents often led to moral distress. Despite education, students may struggle with clinical application of ethical concepts. And one study described in the literature review of this article identified the integration of ethics into personal and professional lives and showed the students' commitment to professional integrity. This study focused on students' ability to identify ethical dilemmas. You'll notice on the previous slide and on this slide there's a pause button which will allow you to stay on this slide until you're ready to move on. There's quite a bit of information in each of these slides, and you may choose to go back and forth between this summary and the actual article. The theoretical framework used in this study includes that various scholars have explained the process of becoming a nurse, including the ideas that theory and experiences lead to reflective practice, and that stimulation of critical reflection encourages caring or virtue. This study used virtue ethics, to be discussed later in week 2, and it was used as the theoretical underpinning for this study. The theoretical framework suggests that students' ability to incorporate ethical decision-making is an issue because of their inexperience and lack of confidence. As you'll learn next week, one of the key ideas to virtue ethics is that by practice and by exposure and by using exemplars, we can learn to live and practice ethically. And the last part of the theoretical framework is that educators need to recognize the importance of empowering students with the knowledge and skill to act ethically. The method in this study involved students studying ethics and at the same time doing a practicum in maternal child nursing where they encountered ethical dilemmas. Participation in this study was voluntary and all of the informants are anonymous. Writing assignments already in the curriculum would be examined and data bits would be included. So bits of the reflection and the written assignment that the students were already conducting were used as the data for this study. They used a what, so what, and now what format, and entries were to include ethical principles, fallacies in thinking, and theories of ethics. The entries were focused on topics such as end-of-life decision-making, healthcare errors, pain management, and professional behavior. The method used for data analysis included reflection, which is descriptive, affective components, which is emotional awareness, discriminant, which is critical assessment, judgment, which is evaluation, conceptual, which is identification of need for more learning, and theoretical, which is demonstration of need for change. And the findings are reported in the categories of themes. And please read these findings on page 503 and 504 of the article, and you'll see that the themes are practicing as a professional and lacking confidence as a student nurse to take on an ethical stand. So in groups in the forum, we'll have a chance to examine these findings and to discuss them and to figure out what they mean for us as nurses and as student nurses. The questions that you will see in the discussion forum, and just a little reminder, you only need to make 2 posts per week, and so just choose one of these questions or 2 of these questions to generate a response. So the first question is, what is a student nurse's responsibility to involve her or himself in ethical decision making? Another question, how did the student nurse in each case know the difference between behavior that was ethical and that which was not? And the third question, what ought the student nurse do in each scenario? And a few more questions. Who has the right to make ethical decisions? Number 5, who is the leader of the healthcare team? Number 6, is expertise in ethical decision-making the sole domain of the physician? Number 7, what is the role of the nurse in the decision-making process? And lastly, how do you think nurses' role in ethical decision-making has changed over time? So that concludes week 1, and I have a few questions that you might like to ponder between now and next week's class. If you think you are a good person and you believe that you are going to be a good nurse, then how does that translate into your role as a student in this class? And another thought to ponder is, how does our engagement in this classroom and with the readings and assignments help us to realize our goals of becoming an ethical human being and nurse?